Welcome Dr. Shetty to Editor Speak. Hospitals run on profit and loss basis. So how do they recover their cost if a patient suddenly becomes critical and passes away?
Madam, there is a humanitarian aspect and there is a commercial aspect to any treatment given by a hospital. The humanitarian aspect is that you treat the patient to the best of your ability. But this involves cost. How does the hospital recover its cost? So there's a fine balance which the hospital has to maintain, otherwise they are going to grow bankrupt.
So then not handing over the body of the patient to the relatives until the bills are paid. Is this the way forward?
This may not be ethically or morally right. It is like the relatives have lost a dear one and you are emotionally blackmailing the relatives to pay the money. And this may not be taken to kindly by courts also. So this may not be a right approach in case of unpaid bills.
So what do the courts have to say about this?
As per the Indian Constitution Article 21, every person has a right to have a life with dignity. The courts have gone on to extend it beyond this. They have said even in death, the patient should be given dignity.
So are there any examples where the courts have taken extreme stand?
In a recent judgment from the West Bengal State Consumer Commission, a patient admitted in an empaneled CGHS hospital had a CABG done. The patient died. The bills were slightly more than what was decided earlier. The hospital refused to hand over the body of the dead patient to the relatives. They made the patient's relative pay a check and then the body was released. The relatives realized on going home that what was charged was wrong and was in excess as was been decided by the CHHS rates. The relatives blocked the payment. The hospital filed a case against the relatives under the Negotiable Instruments Act in a court of law. The relatives were made to appear in court. The relatives were made to give a check and then the case was withdrawn. The relatives and the CGHS authorities realized this is wrong. The CGHS authority made the patient relatives ask for a fine from the hospital. The relatives filed a case of negligence. Even the court said this was unfair trade practice and they made the hospital liable and made the hospital pay a compensation of 4 lakhs.
So then what is the way forward?
This is a difficult question to answer. The reason being, the court says there is a remedy. You can file a case for the recovery of the amount. But when we see practically, the due process of the law is so long that you may not get to see the money in your lifetime. So all the stakeholders have to take a call as to how to go about solving this problem, because this affects the hospitals, it affects the patients, it affects the healthcare industry as such. So I think our peers should find a solution and help solve this problem once and for all.
Thank you, Dr. Shetty, for your valuable inputs.
Thank you.